There are a few things that I actually miss about being a bedside nurse or registered nurse. Becoming a nurse practitioner, it's an amazing journey so far. But there are parts of bedside nursing that will always hold a special place in my heart. I don't know how many persons out there can relate after I'm finished, but I'm going to share with you. And if you're new here, welcome to my page. My name is Stacy, and I would love for you to go ahead and subscribe. All right. When I was a RN, my day looked very different. It looked completely different from what I am experiencing right now as a nurse practitioner. Because as a RN, I was always, on the move. I was assessing patients, starting IVs, administering medications, educating family members, responding to patient changes, and most importantly, I was providing hands-on experience or care. As a nurse practitioner, yes, I do care for my patients, but the way that I care for them, it has changed significantly, and we expected that. One of the biggest things, though, that I miss about being a registered nurse is the fact that I am not using my skills every single day. I used to do that every single day when I go into a shift. As a RN, I felt like I was a little bit more connected to direct patient care, because when you think about senior patient, you have to go into the room, you spend some extended time with the patient, you're able to identify any small changes with your patient, and during that time, you're still building strong relationships during your shift. Now, as a nurse practitioner, yes, I do spend a lot of time with my patients, but a lot of time is spent with diagnosing, developing treatment plans, reviewing lab work, writing referrals, and making clinical decisions, along with ordering, a ton of tests. So for me as a nurse practitioner, no, I use a lot of my knowledge more than my hands. And while I love, being a nurse practitioner, sometimes I miss the hands-on aspect of nursing. I don't know how many persons out there can relate, but I would love to know if you do miss the hands-on, aspect of nursing while you're working as a nurse practitioner. The other thing I miss is the simplicity of the documentation. And yes, I know some persons are going to be like, nursing documentation is not simple. But when you look at, the provider documentation versus the bedside or the registered nursing documentation, when I compare it, definitely it's a little bit different. It is so much different, because I remember when I was working as a registered nurse, I used to document like assessments, interventions, patient responses, and that's it. No, as a nurse practitioner, every note has to support medical decision making. You're talking about having a diagnosis, treatment plans, writing prescriptions, referrals, and billing requirements. That was for every single patient encounter that I am having right now. Sometimes I feel like when I'm documenting, I am documenting every single thought process that I had during the visit, because that's how it feels. I know a lot of persons, they say they're going to do an advanced, program. They want to become a nurse practitioner because it's like they're going to be spending less time charting. But really and truly, that's not how it is. At least from my experience, I can tell you that that's not how it is. I spend a huge amount of time throughout the day with documenting. The other thing I really miss a lot is when it comes on to the handoff. I truly miss leaving work at work. As a registered nurse, usually when I give reports to the oncoming nurse, that responsibility is, handed off to the nurse. And of course, I really care for my patient, but my shift was done at the time. As a nurse practitioner right now, my responsibility, it follows me a little bit differently, because you're thinking about when a patient have abnormal labs, you have to let them know, you're doing medication adjustments, you're, doing prior authorization, you have to be doing follow-ups, appointments, responding to patient messages. There's just so much that you're doing for all of those patients. And sometimes you might have a patient that had like a really touching story or whatever is going on with them, and that just plays on your mind for the entire night or the next couple of days until you see the patient. Another thing I really miss is the teamwork. I know a lot of persons, will hear us talk about, oh, the teamwork is really bad sometimes. But if you have a very busy shift and you're with other nurses, you will understand what I'm talking about here, because you have those persons around you and they are bringing some form of laughter. The teamwork is there, the support during the difficult shift, it is there. And that kind of creates a bond that, that is hard to explain if you've never experienced it. For me right now as a nurse practitioner, I'm still a part of the health team. I think I'm still a part of the health team, but my role can feel more independent. And, you know, as you're working in the house call setting as well, that is even feeling like that because, you know, sometimes you are with probably one person, but you still feel lonely, or you're by yourself all the time, in comparison to with bedside nursing where you always have that support staff around. The next thing that I really miss is the immediate results. A lot of times, you know, when you treat a patient, you can see how, you know, you're making an impact. You treat a patient who is having pain and they let you know that they're feeling much better. You educate a patient and they tell you how they understand it. So you watch them understanding what you just explained to them or you show them. You help someone through the hardest time of their life and you see that they're feeling much better about everything that has been done. But as a nurse practitioner, when I create a treatment plan or I order something, it takes weeks, months before I know whether or not it's working. So the reward that I normally would get at the bedside, I'm not getting it right now. I still do get it, but it just takes a little bit longer for me to see. And don't get me wrong, I love being a nurse practitioner. I absolutely love being a nurse practitioner because one thing about this is that I am a little bit more involved. I play a greater role in decision making. I still educate the patient. I still help them to improve their overall health. But when it comes down to decision making, yes, I love that part because I get a chance to do more for my patient. Becoming a nurse practitioner for me, it didn't stop at me not appreciating nurses or the registered nurses or the work that I did. But in fact, becoming a nurse practitioner made me appreciate nurses even more. Because no matter how much titles you have behind your name, DNP, MSN, AGNP, and the list goes on, nursing, bedside nursing, being a registered nurse is a foundation that helped me and is helping you to become the best version of yourself or as a provider. I don't know how many persons out there are thinking about becoming a nurse practitioner. Are you transitioning? What is your situation right now? Go ahead and leave it in the comment box. And if you have any questions, I will try to answer. But don't forget to subscribe to my You Think Nursing page on YouTube where we talk about real conversations in nursing, being a nurse practitioner, you know, the transitional story from Jamaica to the States or just being an international nurse, the journey. Go ahead and subscribe to my page and I will talk to you in the next video. Until then, bye.